Hi, I'm Maddie, and I'm a student at UC Davis as well as a member of the Student Health Advisory Board. I'm with Rebecca from Student Health and Counseling Services. Could you tell us a little about yourself?
Sure. Hi, I'm Rebecca Aronson from Student Health and Counseling Services. I'm a member of the senior staff there. I'm a licensed clinical professional counselor here in the state of California. I've been working in college mental health for a long time.
And we're talking about co-facilitating with chronic health conditions counseling group sessions.
Myself and then our sports psych intern, Alex Long, we this year are the co-facilitators for the group that we refer to as living with chronic medical conditions and disabilities.
And so is it important to you both because the types of students you were serving and the types of therapy you were offering?
I will just put out a plug for group therapy in general. Sure. It is as effective as individual therapy. We've got a lot of different groups that we run. I'm so glad you all are taking the time to do some podcasting.
Sure, yes.
For folks who are open to a group experience, I think it can be really rewarding, and there's a certain type of growth and learning that can happen in a group that maybe it looks different one-on-one. I also really wanted to make sure that that space still continued for the students who wanted to be in that group, because I think that a lot of students who have chronic disabilities and or medical conditions feel isolated, and it's hard for those students to find each other, to find students that have those experiences in common with. And this group gives an opportunity for students to meet up with folks that are going through similar things and to give support and to receive support. And so I'm really glad that we offer it.
One of your earlier points about like the single versus group therapy kind of reminded me of how it can sometimes be pressuring if it's just you one-on-one with a therapist and you're like, I don't know how to answer that question. Yeah. So yeah, that's helpful. And also to have other people like, yeah, we're going through the same thing.
Yeah.
How does the session that you're running help facilitate those relationships?
When Alex and I start the group every week, we check in with each other about, is there anything that we need to address? But honestly, we really just let the students do the work. That's not to say that we don't facilitate or jump in or try to sometimes manage the conversation. It's always any group therapy facilitator's roles to make sure the group is safe and comfortable and inviting. But I think what's really nice about this group is that the students really want to be there. Yeah, they really want to be there. They want to connect with each other. It's just a matter of like who needs support this week on what topic. And it's just amazing the way the students show up for each other. They're not going to be left sort of hanging out there in the wind. Like, sure, people are going to jump in, offering support, trying to offer suggestions, or just sort of empathizing. Like, that's really hard. For sure, yeah. And, and we're thinking of you.
So is that kind of what a usual session would look like?
Yeah, so we always start by checking in with a group, seeing how folks are doing, what's on their mind. Sometimes we have a certain question that we'll ask as a prompt. Sometimes we might start off with a breathing exercise or just a light physical exercise. Nothing that should cause any discomfort. Sure. Always things that people can do from the comfort of the chair they're sitting in. And then it's just a matter of like, okay, what are we going to focus on this week? And then we just, as facilitators, we just see where the students lead. And then at the end, whoever's kind of closing out the session, we just sort of always try to highlight the themes, like, look at what we talked about today. Here's what maybe even connects these themes. Good. Where do you want to take the work into the week? Because that's also the thing about therapy. Sure. Whether it's in a group, the hope is that you take some of the work from that session and you work on it outside of the session. For sure. There's a lot of focus on like what's maybe one thing you want to do this week to further your goals. What's just something small you can think about? There can just be also situations where we know somebody, for example, has an important doctor's appointment. So kind of sending good vibes on that. Or somebody's having surgery. It's just like, let's come together. What do we want to talk about this week? And really letting the students drive that.
Of like the student population at Davis, who is allowed to access from that sport group?
To be in the group. Yeah. The main requirement is that a student have a chronic medical condition and or disability outside of just a mental health diagnosis, let's say. This is really a space for students who are dealing with chronic pain. But the main thing is that there is sort of a medical issue there, and not just, let's say, mental health, although, of course, our bodies and our minds are connected.
That's very cool that that option exists here. Earlier, you kind of mentioned the sort of like breathing exercises that people do, and also with it being a lot of physically disabled students joining. Are those accessible in our meetings?
We definitely make sure that, first of all, no one has to do any kind of breathing exercise or body-based exercise that they don't want to do. But we do try to, for as much as sometimes our bodies can cause us pain and distress, like our bodies can also calm us down. And so it's important to remember those things as well. And so breathing exercise is more likely to promote calm than not. But that being said, if somebody doesn't want to do it, they don't have to. What I want to also say about this group is it's over Zoom.
Gotcha. Okay.
Yeah. Zoom makes this group so much more accessible, I would say.
Sure.
And there's a really strong preference from members to keep it over Zoom. So it works. It's fine. We want to respect people's preferences on that.
I'm glad you clarified that it was over Zoom.
I should have said that earlier.
Sure, yeah. Because I was just picturing like, well, physically getting there is also potentially,
Yeah, definitely over Zoom to remove any barriers to getting to campus.
And if someone wanted to access these services, how would they go about doing that?
Basically, they can just call our main number. Our main number is 530-752-0871. They can just tell the registration staff that they're interested in being put on the list for the Living with Chronic Medical Condition Disabilities group. And then what our registration staff would do is take that person's information and they would put them on a list. They'd notify me, and then I'll reach out to the student directly. A lot of our groups do require a pre-screening. We do a pre-screening just to make sure it's a good fit. We just want to make sure from students that what they're hoping for in the group, like that they can make that clear to us. We want to talk with students about, like, are you comfortable sharing about your health in the group? Why are you interested in the group? How are you in a group? Like, are you able to tolerate, differences of opinion? Or, how might you handle it if somebody's like really very emotional and really upset? Like, how might you be able to handle that in the context of a group? So there's just some things to help us get a sense of, like, is it a good fit? And it's also a chance really for students to ask us all the questions they have.
So is it kind of like an informal interview where they find out, like, if they want that option, you guys figure out if that's a good fit?
Yeah, definitely. It is like that informal interview. We call it a screening. Yeah. Students may decide, like, I don't know if I really want to commit to it. Because we do ask students to commit for the quarter in which we're in. So, that in any given, let's say fall, winter, or spring quarter, we can run 7 or 8 of these groups.
Oh, wow.
And so we really do want students to commit to being there. We get if someone has an appointment or, something pops up and it's unavoidable, but, we wouldn't want it to be where someone just, like, you never knew if they were going to be there. So we do ask, like, can you commit to that? Obviously, is the day and time okay for you?
Sure.
There's been a sense, I think, of friendship that have evolved between students who've attended the group for a while. And we're fully supportive of that. Like, we do want students, especially in this demographic, to feel connected.
For sure.
To new students. So as long as confidentiality is adhered to.
That's awesome. Yeah, it'd be kind of silly to be like, no friends for you, but...
Right.
Yeah, so I'm glad that that's, like, something that they can connect to with that, especially if it's like a per quarter thing.
Yeah. Students can attend this group more than one quarter.
Sure.
So it's not like you just get one quarter and you're done.
Yeah.
So and many students have stayed more than one quarter, which is great, because when you have a number of students who stay for a while, like, things can get deeper. There can be more meaningful, I think, conversation, exploration, and connection.
And I assume, like, no limit on the number of quarters. So if someone started as a freshman, they can do it the whole time.
I'm going to say yes.
Okay.
I don't know that there's a policy.
Yeah.
But I'm going to say yes.
Okay, great. That's good to know. I guess another question that I have related to like the onboarding process is about how long does it take between someone expressing interest in being able to join the group?
That entirely depends on how quickly the student gets in touch with me or Alex, because Alex will also do pre-screenings as well. But if somebody is put on the wait list, I reach out to them pretty quickly. If you get back to me quickly, we can have that pre-screening scheduled within, I mean, we can have the correspondence about it within 24 hours. And the screening itself is only 15 to 20 minutes. It's really not meant to be like a very lengthy
good
process. We've got a couple questions that we have, and, that's that.
Is there anything else you'd like to promote or highlight that we maybe haven't talked about?
I just would really encourage students to go on our website and, the Student Health and Counseling Services website. When you go on the counseling page, you can easily find a link to our groups. And I would just encourage students to take a look at them. Sometimes our groups change from quarter to quarter, but there's a lot of groups that have been there for a while.
Sure.
And they really do meet a need. And so I just check it out. It's another option for treatment here on campus.
Yeah.
And for living with chronic medical conditions and disabilities, I would just say, like, if you are feeling isolated, if you're feeling like you just want support with how to manage academics, relationships with family, friends, partners.
Sure.
If you want support in like knowing how other people advocate for themselves, how do people manage difficult interactions with medical providers, how did somebody get the wheelchair they needed? Sometimes we also talk about pain management, although I want to be clear, like, I am not a doctor. My co-facilitator is not a doctor, so we're not recommending, try this or that. But sometimes students will share, well, here's what's worked for me. But we're always really clear, like, if something is really unmanageable, we do want you to talk to your doctor. And sometimes that's part of the experience is just saying, like, I really do think you have to go back to your doctor for this. Talking about how to prepare for medical appointments, acceptance of one's condition is a big theme too.
Sure.
Which doesn't mean resignation. But at a certain point, like, sometimes we have to like come to a sense of acceptance of, like, here's where things are and how do I live the fullest life I can live. Oh, and I would also say we talk a lot about campus resources too. So getting linked with SDC, how much to disclose, let's say, to a faculty member or in a job interview or things like that. Those are also important conversations.
Thank you so much for meeting with me and coming on this podcast.
Thanks for having me.
Yeah, it's been super fun.
Yeah. Grateful for the opportunity.
All right, this is Aggie Talks Health. I'm Maddie. This is Rebecca. And we'll see you on campus.